Hey YouTube, it's Jen, and it is week 13. I cannot believe that it's been 13 weeks since my surgery for my gastric bypass. I am excited and just flabbergasted at the time. It's kind of flown by. So let's do the stats. My highest weight recorded was 245 pounds. My weight at the time of surgery was 216 pounds. My current weight as of today is 170 pounds. And my first goal weight is 150. So since surgery, I've lost 46 pounds, and I am only 20 pounds away from my first goal weight. So I'm elated because, wow. Years and years, I mean, I like most of you, have dieted and exercised and did the fad diets and the crash diets, and I could take off maybe 15, 20 pounds at most, and then within a month of stopping or some life event happens, I've always gained it all back, plus 10 or 20 on top of that. So I'm excited. I've actually done this video 3 times today, and when I finally had a video that was just how I wanted it, I deleted it because they put the delete button and the save button so goddamn close. Anywho, okay, so I wanted to kind of throw something out there into YouTube land. I am a member of a couple different bariatric sites on Facebook, and what that is just a bunch of us bariatric patients together. Someone or a couple people form different groups, for the supports and stuff and all that, and so far it's been really good. And in one, I don't want this to come off like, oh my God, I'm such a bitch, but in one group in particular, I've noticed a lot of people asking questions that are kind of, they really are meant for your bariatric team. Like, I'm just going to throw this one out there. One poster actually mentioned how they were blacking out and after they ate or something all the time, and they were asking Facebook, like, hey, what should I do? It's, common sense. Call your doctor. Don't ask Facebook. None of us are close enough to each other to, to help, and none of us are bariatric. Nurse practitioners, we're not bariatric surgeons, we're not bariatric nutritionists, and we don't know everyone's full story. So of course, I'm curious to see what, because this person had like 60 comments, so I'm curious to see what people were saying, and maybe 1 or 2 other people said it happened to them, and everybody else was just like, oh, it's this, it's that, you're not getting enough protein, and blah, blah, blah. That may be true, but it may not be. It could be actually something serious. So my advice to you guys, those of you watching, is it's okay to ask those questions. Of course, I'm not saying don't ask. Feel free to ask, obviously, whatever you're going to ask, because, you're going to do it anyway, so that's fine. But I think the final say should really come from your doctor. So if you're having, issues, if you see other people talking about taking this medication for this thing, and, like my hair is falling out, but I'm taking this over-the-counter medication, always ask your doctor before you start taking it, because you'd be surprised. If you're taking other medications, that might interact with that. Your body, might not absorb it or whatever. It's just always, caution, safety first. Always, I stress it. Just always call your surgeon, your nurse practitioner, or your nutritionist, because everyone is different. Everyone's journey is different. So just please, use common sense. You were born with it, so use it. That kind of brings me to my next kind of topic was not really common sense, but I guess you know, like stress eating and stuff like that kind of comes along with that. You know, like you're losing your hair, you're coming through a new journey. It's only so many months. You're, you know, psychologically starting to develop a little bit different because, you know, the weight loss, and, you know, you may feel, you know, your personality, it might be coming out more than it used to. Or I've actually seen and heard people actually become more withdrawn as they've lost weight. So I want to kind of talk about stress eating because I've noticed, for me personally, I have caught myself a couple times grazing, and I know that I wasn't hungry, but I was still doing it. And for me, that's a gateway thing, because if I continue to let that habit form, that eventually will turn into, oh, well, I can have this and I can have this, and oh, I already had this snack and I'm up to 3 snacks, and the next thing you know, I'm up to 10 snacks, and I'm just all I'm doing is eating snacks. So I kind of developed this thing for me where I move my treadmill into my bedroom, and I have some free weights and stuff in this room, and I keep like weight loss type books in like my bathroom. So kind of every room has something weight loss related. So that way it's a visual reminder for me that, hey, you had surgery, you know, cut that shit out and, you know, get your ass moving. So far so good. I mean, once I'm done making this like 80th video, I think I'm probably going to get on the treadmill and run 1.5 miles. So I don't know. If you guys don't have like a plan or anything for like stressful events in your life or anything, I suggest to, you know, kind of find something that you like to do, something that, you know, we're supposed to be exercising anyway. And for me, I always felt that exercising was a good stress reliever. Swimming is awesome. And even if you can't do a lot of weight bearing exercises for whatever reason, swimming is absolutely awesome because it takes all the pressure off your joints, and you can actually go in and you're getting a workout and you don't feel like you're getting a workout. So I suggest if you're going to start anywhere, start with swimming. I mean, go to your local pool, local YMCA, or, you know, whatever, and, you know, go. It's definitely worth the money to do something for yourself like that, because in the long run, you're going to feel great. You are going to absolutely feel great. And I've noticed a lot of people kind of very upset that people that are very similar to surgery dates and all that are losing more weight than they are. And one person actually called somebody out on it, almost a liar, that there's no way that person, like, oh, there's no way that you could have lost 75 pounds in 4 months because I had that same surgery date and I've only lost 50. Like, wow, really? Like, I swear, like, we're catty. Like, women, we are catty. And I feel like the more weight we're losing, the more crazy we're getting. Like, really, calm down. And again, like, we don't know other people's stories. We don't know their medical histories. And we certainly don't know, unless they tell us, like, how much they started when they first started. Like, someone who was 300-400 pounds is most definitely going to have a higher weight loss in the first couple months than someone weighing 200 pounds going into it. I mean, because if it was that easy, holy shit, can you imagine? So slow your roll. Okay, just remember, your journey is your journey, and it's different for everybody. It's not the same. I mean, as you can probably have seen, different bariatric centers have different rules and regulations for each patient and each procedure. So, you know, please stop arguing about, you know, you could have this on this week and I have to be on purees. Oh my Jesus Christ. So just you wanted to throw it out there. I know this is a crazy like video, and I'm really just like harping on the Facebook groups, and I do. There is and believe, don't get me wrong, there is a ton of great information, recipes and stories and personal goals. Like, all that is great. It's just there's always a couple people in there that you really want to bring them by their neck, you know, because, you know, it scares off the pre-ops and you know, the poor pre-ops. If I was a pre-op just starting out and I was in one of these groups and I saw this, I would be terrified. And then on top of that, it's, you know, I would feel that the weight loss community was not supportive, and that is not true at all. It just, you know what I mean? You know? Okay. All right. Well, that's enough for me. I've ranted for like 12 minutes. So please, if I've offended anybody, I really apologize. But I just kind of, it's been something that has been bothering me the past week that I've been kind of witnessing on these Facebook groups and stuff. So, I don't know. All right, guys, I'm going to make a second video actually later on because I wanted to show you some of my fitness stuff and kind of give maybe anybody out there an idea to where to start if they wanted to start. So I will see you guys later. All right, have a good day. Bye.